Hello, everyone. Good morning. Live from New York, we would like to welcome you to our Nursing Now Challenge Global Solutions Initiative. I would like to welcome you from New York Presbyterian and representing over 10,000 nurses from our organization. My name is Rhoda Redulla, and I'm the Director of Nursing Excellence and Magnet Recognition for New York Presbyterian. We are a proud partner and host to the Global Solutions Initiative by Nursing Now, specifically on nursing retention and well-being. We are, just to share you a little bit more about the Nursing Now Challenge Global Solutions Initiative, through the Nursing Now movement, we have an opportunity for nurses and midwives all over the globe to connect, share experiences, and develop innovative solutions to ongoing global health challenges. So the themes for past global solutions initiatives have ranged from brain injury recovery and rehabilitation, for example, nutrition, the climate crisis, vaccine equity and acceptance, where our own Amy Staley, who is one of our clinical nurses, very much involved in Nursing Now, was able to implement her project last year, which is continuing through this day. We have been, as an organization, New York Presbyterian have been a part of Nursing Now since 2019. This was in preparation at that time for the International Year of the Nurse. And today, we are proud to have our session 2, really honored to be proud of this session 2 of our Global Solutions Initiative on nursing retention and well-being. Just for a short intro on our topic, we know that well-being affects each one of us, individual nurses and our teams, in terms of physical and mental health, joy and meaning in our work, including professional engagement and satisfaction in our day-to-day work. So today I'm really excited and honored to welcome all of you from all over the globe to hear from our panelists, our leaders and clinical nurses. And to kick this off, I would like to hand this over to Dr. Bernadette Can, who is our Group Senior Vice President for our Columbia Division. And I will have Dr. Can introduce herself a little bit more, who will be joined by Stacey Stenglein, who is our Patient Care Director from our Morgan Stanley Children's Hospital, who is responsible for our pediatric medical surgical GI transplant units, and that more with you as well in a little while. So without further ado, I welcome you all to our session 2. Thank you.
Thank you, Rhoda, and hello again from New York City. As Rhoda said, I'm Bernadette Can, and I'm the Vice President and Chief Nursing Officer here at Morgan Stanley Children's Hospital. And co-presenting with me this morning is Stacey Stenglein. She's one of my patient care director at the Children's Hospital. And it really is an honor to be able to talk to you all about some of the work we did here related to nurse resiliency in the post-pandemic era. So Stacey, could I have the next slide? Before I tell you about that work, I wanted to tell you a little bit about Morgan Stanley Children's Hospital. The hospital is actually a standalone women and children's hospital, and we're actually one of 10 hospitals in the New York Presbyterian enterprise. It's a 284-bed facility, as I said, consisting of OB and pediatric beds. We are very proud that in 2021, we received our first magnet designation. So yay. We're also ranked the #1 children's hospital in New York by US News and World Report. And we are a level 1 pediatric trauma center and a level 1 children's surgery center as designated by the American College of Surgeons. And we're also extremely proud that we are one of 5 ECMO programs in the world that has a Platinum Center of Excellence by ELSO. So incredibly proud of that. Some of our metrics, just to give you an idea of how busy the hospital is, we have a little over 4,000 deliveries every year, a little over 16,000 discharges, and almost 60,000 emergency room visits. Next slide. So before we talk about the work, I wanted to give you a little bit of a background of how this all started, and then I'll turn it over to Stacey to really share the work that she, along with the rest of her committee, did. And as you all know, New York City was the epicenter of the COVID-19 pandemic. And all of our adult hospitals during the pandemic was really at full capacity. As a matter of fact, they were over capacity with adult COVID infected patients. And fortunately, in 2020, the virus did not really affect or infect children at the same rate as adults. And so basically what that meant was we had capacity as a children's hospital. And so we made the decision to accept all of our pediatric populations from all of our 10 hospitals that had peds patient to come to us. So we became the sole pediatric hospital. During that period, we did see some COVID infections in some of our pediatric population, and in our OB population, we also saw some an increase in the infection rates there. But despite that, we still didn't have full capacity. And we saw that our adult hospitals were really so packed and overwhelmed with patients. And so we pivoted, right? And began to admit adult patients into our ICUs and our med-surg unit. And we actually even saw adults in our emergency room. So here you have pediatric nurses in our ICUs caring for adult ICU patients, and the same in med-surg and the ED. And honestly, the team were incredibly engaged and just felt really good about helping. The issue is this pandemic didn't end in 2020. And so as we entered 2021, nurses really started to not be in a good place. We had significant turnover. Many nurses who were really kind of debating about if they should retire left the profession and said, you know, I've had enough of this, I'm leaving. And so we had significant turnover at the end of 2020 into 2021, significant burnout, as you can imagine, and just overall a decrease in resiliency. Nurses were getting really tired. And so at that time, I met with my leadership team and really challenged them to think about strategies that we can work on to decrease resiliency. And so Stacey was one of my first leaders to actually raise her hand and say she would like to be part of this committee. And so Stacey, along with a couple of my other leaders and frontline nurses and some other supporting colleagues, came up with what Stacey is about to tell you about. So Stacey, with that, I'll turn it over to you to talk about the work you and the committee did.
Wonderful. Thank you so much, Bernadette. So as Bernadette mentioned, I'm a patient care director at Morgan Stanley Children's Hospital, and we certainly recognized being on the front lines with our staff, the significant challenges that were presented. Nurses were not only caring for patients, adults, and children, but also caring for our family and loved ones outside, whether it be homeschooling their children or taking care of loved ones as well. So we pulled together a multidisciplinary task force. Actually, one of my co-task force members, Allie, is on the call today, and you'll get to hear from her in a bit. But we met with Bernadette, and she basically gave us full control to create whatever we thought would be helpful to support our team. So we met together with members from nursing leadership team from all of our different departments, frontline nurses, our child life staff, our MIPB healthy coaches, and representation from our chaplain services. And we kind of sat down and just started to discuss what was going on. How were people feeling? We wanted to kind of get a pulse on what people needed so that we could best come up with a solution to help address the burnout and increase resiliency. So again, as we mentioned, it was an unprecedented time. Nobody has ever lived through a pandemic like we continue to live through. And it definitely impacted all of our staff members at all levels, not just including nurses. We recognized that nurses were feeling burnout, not only at work, but not really also getting a break once they went home from work. And in turn, we were seeing increased turnover, increased number of vacancies, and decreased RN satisfaction and engagement. So we went to the literature first to see, how can we get some quantifiable measure of what the nurses were feeling. So we created a survey using the Maslow burnout inventory that we sent out to our teams, and I will discuss the results of that survey in the next few slides. So we created a resiliency menu, and we tried to kind of go with a spa vibe of a menu. And we looked at what are all the different tools and resources. We were very fortunate to be supported by our organization through the pandemic, and we're offered a multitude of resources. So we wanted to find a quick way to pull all of those resources together in something that was easily accessible for the staff. So in our meetings, we came up with a resiliency menu quick deck. So it's a little ring of cards. We color coded them in fun colors so that anybody could access them. And each card had a QR code on it with a link to an activity to help them. So we had things to do for fun, like jokes, just coloring pages, things that the nurses could print out, mindfulness activities, movement, different stretches, chair yoga, quick activities that they could do on the unit, music and art, so links to music and videos and calming opportunities for the staff, and then positive affirmations that they could repeat. My favorite one is there's a hand washing affirmation. So it takes about 20 seconds. And so while you're washing your hands, you just kind of repeat this affirmation to yourself before walking into a patient room. So we tried to make them things that were quick, easy, that you could just take a few moments on the unit and utilize the tools. So we conducted resiliency rounds to demonstrate use. So we partnered again with our NYPB Healthy coaches during Nurses Week to roll out the project. We got little squishy stress balls for the nurses to pass out. We rounded on all the units to educate the teams about how to use the cards. We also picked a standardized location. So every unit has a goal board, and we posted the resiliency menu and the card deck there so that it was easily accessible and everybody knew where to get it if they wanted to use it. So we found that to be very helpful to round and create a lot of energy and excitement around utilizing these tools. We also held training sessions with our unit practice council, led by our chaplain and Be Healthy coaches, teaching them how to facilitate and utilize the cards so that it wasn't just leadership saying, here's the tools to use. We really wanted to empower the staff to, if they recognized the peer was having a hard time, to say, hey, why don't you take a few minutes to take a break, get the cards, and take some time for yourself. And then in June of 2021, we began implementing elements from the resiliency menu across all of our meetings. So for example, we have tiered huddles. So every day we start with a 7 a.m. huddle where frontline staff meet with the leader. And so we have incorporated either a deep breathing exercise or a moment of gratitude, something, or a joke to start the day, just to kind of set everyone's intentions and let everyone take a deep breath before we start our day. We then at 9:30 in the morning have our tier 2 huddles where frontline nursing leaders then meet with our next level of leadership. And we have themed days. So Monday we do a mindfulness activity. Tuesdays I lead a gratitude challenge. Wednesdays we do a wacky Wednesday and tell a joke. Thursdays we do some type of movement, Namaste Thursday. And then Friday we do favorite photo Friday. And it just kind of gives you a minute at the beginning of the meeting to just stop, reflect, and put yourself in the right headspace before going into a meeting. So we really tried to make sure that these elements flow through across the board so that we're teaching new hires as they come in that this is what you can expect as a part of NYP culture. And then they're seeing that kind of flow through as they spend their time on the units. And then from June to September, we just worked on hardwiring the process, training more staff, and having them feel more comfortable leading these exercises. So this is an example. The actual deck is much prettier because we have them color coded, but you can kind of see. So we have, a list of instructions of how to use the QR codes, what each color code means, and what you can expect to find. We also have COPE NYP, which is free counseling services. So we have a link to that if that's something that staff need. Links and information about our NYP Be Healthy program, links to pastoral care and our SOS program for on the spot support if a staff member is really struggling, in addition to all the resources that we've collected. And this is an ongoing toolkit. So with these QR codes, we update them with different resources as people bring new ideas and find things that they like. Our task force continues to meet bi-weekly to take feedback and update and grow on the deck that we initially rolled out. So taking a look at, did this have an impact on our staff? So we created a tool that we sent out as a survey, again, using the Maslow burnout inventory. And we sent that out to our nurses pre-intervention, and then at 1 month and 2 and 4 months post-intervention. And as you can see, so we saw positive feedback and results post-implementation, and did see a decrease in nurse burnout and an increase in feeling more resiliency. So what are our next steps? So we are looking to condense the rings of cards and make pocket cards with a generic QR code that will link to all of the resources that are in the slide deck. That way, nurses, if you don't have time to utilize the resources during your shift, or somebody else is using the cards, you'll have one that you can easily access. And it's also accessible once you go home if you feel like you need a little extra support at the end of your day. We are also working to identify space on each unit for a resiliency corner, and we're partnering with our integrative therapies department to provide aromatherapy, as well as other remembrance and renewal resources, so that you can take a few moments to just take a deep breath and separate yourself from whatever is giving you stress on the unit that day. We're continuing to educate and recruit unit-based champions and incorporate these tools into our training for all new hires. And again, continuously updating our resources to make sure that the toolkit is really serving the needs of our staff. Any questions?
Thank you so much, Stacey and Bernadette. That was just amazing. And I love that you have those menu cards. I love the bundle of interventions that you have. And it just reminds us that a lot of these things that we can do to make an impact can, don't need to be anything like super grand, like simple things that we do in the most thoughtful way. So kudos to you, Stacey, and the entire Morgan Stanley Children's Hospital team, and of course, under the leadership of Dr. Bernadette Khan. We will have some time for questions in the end, but I would like to pivot quickly to our next presenters. Yes, amazing. We have like lots of comments in the chat box. I would like to call in our New York Presbyterian Wellbeing coaches, Hajra, Jaffer, and Allie, Lohrer, who will be presenting to us about mindfulness and will be sharing us some best practices and strategies on mindfulness. Thank you.
All right. Hello, everybody. It's morning here, but I know it's different parts of the world, so I'm going to say hello instead of good morning. Thank you all for including us in your agenda. My name is Hajra Jaffer. I am one of the NYPB Healthy coaches. I'm a registered yoga teacher and a national board certified health and wellness coach. My co-presenter today is Allie, Lohrer, who is also a health and wellness coach with me and is a registered dietitian. We have 9 health and well-being coaches at NYP, and each campus believes in the power and importance of a well-being coach. So today I want to do a few exercises with you, because what Stacey told you, what Bernadette told you, what Rhoda told you, how can we, those are things we know, how can we bring it all into action? So I'd like to do a few mindfulness-based exercises with you, and kind of really take away the myth of what mindfulness is. So mindfulness is very important. Why is it important? Because as nurses, you constantly focusing your energy on other people. It's a selfless job, right? And it is important to take out a few minutes to focus on yourself so you can fill that cup that is constantly emptying. Because when that cup is empty is when you go through compassion fatigue, stress, burnout, and all the other things that can affect your well-being, and it affects your family life, your career life, and additional challenges and stress, right? So what is mindfulness? That is the big question, because there's meditation, which you all know of. That's a formal mindfulness, formal practice of mindfulness. But the mindfulness I want to talk to you about today is informal, and it can be practiced anywhere, anytime. The only caveat is you have to remember to do it. All right, next slide, please. So I love this slide because it is talking very much about what the evidence says. Mindfulness-based programs can help nurses develop skills to manage clinical stress, improve their health, increase overall attention, empathy, and presence with patients and families, and experience work satisfaction, serenity, decreased incidental overtime, and reduced job burnout. This is in the nursing one of the nursing management journals. So as you can see, the power of mindfulness is evidence-based and it's all over. But how do you practice it? Next slide, please. So informal mindfulness can be practiced, as I said, anywhere, anytime. The key is, what am I doing to get myself out of the mind wandering? Two Harvard researchers did some studies, and they found out that over half the day, or over 40 to 50% of our day, our mind is wandering. And the title of the study was, "A Wandering Mind is an Unhappy Mind." So what mindfulness is, as defined by Jon Kabat-Zinn, it basically is, did I go back a second? Can you go back 1 second? Sorry, Andrea. I have the mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. All right, next back slide again. So what that is saying, and I love Jon Kabat-Zinn because he is the founder of the MBSR program, the Mindfulness-Based Stress Reduction Program. And in fact, some studies came out recently that if you do this 8-week program where they're teaching you to be more mindful, it can also play a role in anxiety and depression and all the other diseases, mental health problems that we know about. So how do you practice this informal mindfulness? It is like a muscle. The more you exercise it, the more developed it becomes. Just like there's exercise for the body, this is an exercise for the brain. When your mind wanders, how do you stop it and bring it back to the present moment? So let's talk about activities we do. From getting up in the morning and taking a shower to brushing our teeth. How many of you actually remember how the water felt on your body or how the soap smelled? We take that shower, right? But we take the shower, brush our teeth, and out the door, and then patient to patient to patient, your job is, right? Taking out a few moments to pay attention to that shower or pay attention to the brushing of the teeth. I've literally put a sticky note on my bathroom mirror so I can remember. I realized that most of the time I do not do the 2 minutes that my brush tells me to. And I think most of you are the same. So really bringing your mind back to what you are doing and being intentional is what mindfulness is. So engaging in washing the dishes. As I said, that study said a wandering mind is an unhappy mind. So when you are participating in normal things, like washing the dishes or cleaning the house or brushing your teeth, if you pay attention, there's a greater chance that you will be happier. Pausing throughout the day. As I said, and I keep saying, your lives are really, really busy. And I cannot be grateful enough for all you all do as nurses. You keep us all healthy. And that is huge. But how many times do you take out a few minutes to step back and take a deep breath or just pause? These are all forms of mindfulness. Getting out of that go, 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 stopping for a little bit, focusing on what you're doing, and then being able to respond instead of react. And that's what mindfulness do. It allows us to stop, pause, and reflect rather than react, because then we're responding. How your body feels. That's again what the John Kabat-Zinn mindfulness-based stress reduction program, he teaches us how to do body scanning. How many times you've gone through the whole day and you come back home and you just collapse on the sofa? That is again what can lead to burnout, because we're ignoring our body. Taking a little bit of time, how does my head feel, my neck, my shoulders? Our body gives us signs. The key is to pay attention to those signs. Moving your body mindfully. Allie will be leading you on a mindful stretch. That is so important. As a yoga teacher, I can tell you, yoga has shown to help against stress, help against inflammation. And you do not always have to do it on a mat. You can do it on a chair. Even when you go out for a walk, how many of you pay attention to what's around you? So mindfulness is paying attention to inside. Are you hungry? Are you thirsty? And outside, the beauty around you, being more curious. Again, when you're more mindful, you're able to be kinder to yourself. You're able to realize that chatter in the head, that self-talk. That is self-compassion. And self-compassion is key in our health and well-being. It even helps with heart. And this is the start. Today's February 1st. It's American Heart Month. So all these things, being mindful, it helps for your heart too. And eating mindfully, Allie will talk more about that. So I like this little quote by the Emory professor. Mindfulness is a path to help us reconnect with what brings meaning to the profession. It brings humanity back to healthcare. Oh, next slide. So even having a simple cup of tea, and you know that whole thing, stop and smell the roses. I try to do that with my tea. When I'm having my tea, I try to really enjoy the tea rather than gulp it down. All right, so the best way to start is something you do every day, which is breathing. But the problem is we don't pay attention to our breathing. And again, like everything else, it's go, go, go. We're holding our breath most of the day and we're shallow breathing. And studies have shown that deep diaphragmatic breathing can slow your heart rate, reduce blood pressure, and it can stimulate the vagus nerve, which reduces that chronic stress or that cortisol or that adrenaline, the fight or flight response that causes feelings of anxiety or tension. So knowing doesn't bring change, action does. So let's do this together. I would like to do 2 breathing exercises with you. The first one is my favorite. I do it before any presentation. I do it before I go to bed. And it's 478. It's by Dr. Andrew Weil, and it's called an anti-anxiety breath. Quick thing before I lead you on it. Some people don't have the lung capacity to hold in for 7 and blow out for 8, because it's inhaling for 4, holding the breath in for 7, and then exhaling like you're blowing out candles for 8. So we're trying to double the exhales to the inhales, because that calms the body down. So if you can't do 4, 7, 8, do 2, 3, 4. Shouldn't hurt, no judgment. That's mindfulness, whatever makes you feel better. All right, so I will lead you on it. The first time I will say it out, and the second round, I will just show you my fingers. Everybody get to the edge of the chair, dig your feet in the ground. That's the first thing, feeling grounded. The moment stress comes, feel your feet in the ground. That's called being grounded. It gets yourself out of that wandering mind again. Get your hips, feel your hips in the chair, everybody. Feel it nice and heavy into the chair. Roll your shoulders up and back. All right, now we're gonna breathe through our diaphragm. Inhale, 4, 3, 2, 1, hold. 6, 5, 3. Blow it out. 8, 7, 6, 5, 4, 3, 2, 1. One more time, and I'm gonna do it with you, so I'm just gonna show you. Inhale, hold. Exhale. That's the 4-7-8. The abdominal breath. One hand on your chest, one hand on your belly. When you breathe in, feel the belly rise. And when you breathe out, feel the belly fall. So the hand on the belly should move, not the hand on the heart. Let's do that. Inhale, feel the belly rise. Exhale, feel the belly fall. One more time. Inhale, feel the belly rise. Exhale, feel the belly fall. There you are. That is mindfulness. That helps with neuroplasticity. So one exercise was the breathing. Next one. The next exercise is again an exercise that I feel can help, should help all of you guys. Next slide. It's called STOP. And it's an acronym for 4 steps. S stands for stop and disconnect what you're doing. So if any of you are doing something else on your phone, something else on your computer, please stop and disconnect. The T stands for take a deep breath. The O stands for observing how we're feeling. And the P will stand for pausing and proceeding. Again, knowing doesn't bring change, action does. So let's do this together. I would like you to put your feet on the floor again. Disconnect, which is the S. If you can, close your eyes, because that helps. And then I will lead you. Inhale through the nose. Feel the breath go to the back of the throat. And exhale through the mouth. Inhale, feel the belly rise. Exhale, feel the belly fall. Inhale, see if you can, when you breathe in, feel like you're entering relaxation into the body. Exhale, see if you can let the tension leave. On this last inhale, breathe in that fresh, oxygenated air. Breathe it in, breathe it in. Exhale, let out any stale, negative air. So that was the T. The O stands for observation. We're human beings, not doing. So let's be in this moment and just tune into whatever arises. How many times do you ever get to do that? Maybe think about, observe your thoughts. What are they telling you? Are they facts? Most of our thoughts are not facts. Maybe pay attention to any emotions you're feeling. It could be sad, happy, angry, sad, anxious, or neutral. It doesn't matter. The point is to tune in, and labeling emotions can help with strengthening that resiliency. Maybe you observe any sensations, and just a gentle scan of the body. Do you have any stiffness, any pain? And now we come to the last step, which is P. P stands for pausing. Giving yourself that gratitude that you took out a couple minutes to take part in this exercise. And realizing that you can do this anytime, anywhere, even if it's for a minute or more. It can be your tool to calm your body and mind down. And then maybe sending that gratitude to the rest of the world or the rest of the team of nurses who are on this Zoom, and opening your eyes with a smile. Smiling helps with endorphins. It helps with feeling happy, feeling better. And so I will end with mindfulness-based treatments have been shown to reduce anxiety and depression. There is also evidence that mindfulness can lower blood pressure and improve sleep. It may even help people cope with pain. Now I will let Allie go over the eating and the moving. Thank you so much. And if you have any questions, we look forward to hearing them at the end. Allie, take it away.
All right, thanks, Hajra. Hi, everyone, I'm Allie. Hajra provided a bunch of great tools to incorporate mindfulness into your day. I definitely needed the conscious breathing and the stop practice right now. Sometimes we all need to just slow down and take that time for ourselves. So if we can actually go to the next slide, that would be great. Perfect. So as I'm a registered dietitian, I also wanted to discuss how you can apply these mindfulness skills to your eating habits. So mindful eating is bringing awareness to your food choices, your eating experience, and how you feel. The intention is to eat in a way that is satisfying and nourishing for your body. So let's talk about tips to get started on mindful eating. First off, you want to try to limit multitasking and distractions while you're eating so that you can be more present with your meal. This might include avoiding technology, and I know we're all really busy, so it's not always ideal, but it can make a big difference. And before you begin eating, you can take a moment, notice the beauty of your plate, appreciate your food and where it might have come from. While you're eating, you want to try to go slowly. Notice and enjoy different flavors, textures, smells, enjoy every bite, and you can take pauses in between. You want to try to reflect on your hunger and fullness cues, and eating slower actually helps with your digestion. You might realize that you're fuller sooner than you thought. And in addition, food is very connected to our emotions. I experienced this myself. You want to pay attention to how you feel before you make a food choice. So are you eating for other reasons than being hungry? Maybe feeling stressed out or tired. This is normal at times to eat when you're not feeling physically hungry, but again, it's something to be mindful of, take note of, and notice how often that you're doing it. And maybe from there, you might want to make some changes to this habit. And overall, mindful eating is a beneficial practice because it improves our relationship with food. It reduces stress around food and really allows for more enjoyment. Food is meant to be enjoyed. So it's not meant to be restrictive or feel guilty about our food choices. It really allows for a more sustainable way of eating to feel your best. And the key isn't to be perfect. As I said, I know we get busy sometimes, but do your best to try out some of these practices and see if you notice the benefits. So from here, we're going to move on to the next slide. We are going to talk about mindful movement. Chair yoga is proven to help with fatigue, focus, flexibility, blood flow, and mood. So we'll do some light stretches together if you're up for it. Only do stretches that you're comfortable with. If there's any moves that you don't want to do, just take a moment to breathe instead. Maybe one of the practices that we just did with Hajra instead, if you prefer. But during these movements, if you can join us, try your best to bring awareness to your breath and how your body feels as it moves. So we're going to follow the pictures on the slide. We're going to start with a seated cat-cow position. So you can start this by sitting straight in your chair with your legs hip-width apart. You're going to have your feet flat on the floor and your hands on your knees. What you're going to do is we're going to inhale, and you're going to slowly arch your back, roll your shoulders back, and look up at the ceiling like a cow. And then you're going to exhale, slowly reverse the position, round your spine, allow your head to drop and chin to move toward your chest like a cat. We'll do one more round of this. So let's inhale, roll your shoulders back, bring your head up. And exhale, come forward, bring your head down, roll your shoulders forward. All right, great job. We're going to come to a neutral position. For our next move, you're going to extend your arms out in front of you, and we're going to do some wrist circles. So we're going to start by moving your wrists in an inward motion. Just going to do this a couple times to stretch it out. All right, we're going to go the opposite direction. Great job. All right, and next we're going to open and close our fists. Just stretching out our hands, our wrists. All right, shake off any excess tension. And again, we're going to bring our hands forward. You're going to clasp your hands and stretch it out. Feel a nice stretch in your hands again and your arms. Take a deep breath here and exhale. All right. Now you're going to bring your hands behind your back And you are going to take a nice spinal stretch, look up at the ceiling. And again, we're going to inhale and exhale. Good job. You're going to bring your arms back to your side. Now we're going to inhale, bring our hands up to the ceiling. And we're going to take 2 deep breaths here. So we're going to inhale and exhale. We're going to go over to the right side. We're going to hold it here for 2 breaths again. Inhale, exhale. One more. Inhale and exhale. Great job. We're going to go over to the other side. Inhale, exhale, and one more. Inhale and exhale. Back to the center. Bring your arms down. Again, you could shake it out if that feels good. And hopefully you feel a little bit more energized from that practice. I know I do. Sometimes we need to take the time to do these things to refresh. So we're going to head to the next slide. And we're going to talk a little bit about self-care. So all of these mindfulness practices are acts of self-care. The American Psychological Association defines self-care as providing adequate attention to one's own physical and psychological wellness. So self-care is really a necessity to manage your stress levels and help you to feel your best. Try to think of self-care as small practices throughout the day. So some of the things that we even did today. We spoke about nourishing your body, moving your body in a way that feels good for you. It can be a stretch like we did, or maybe it's walking or dancing for you. And remember, self-care also requires making sure you're getting enough rest, recharging, taking breaks when you can, even just to pause and take a few deep breaths like we did earlier. And don't be afraid to reach out to someone for support. We all go through stressful times. It's okay to show that you're not okay. And another reminder, as Hajra mentioned, remember, you have to fill your cup because you can't pour from an empty one. And that's one of my favorite quotes as well. So we'll move to the next slide. And so you can start prioritizing yourself today. Don't feel like you have to start on a Monday or a different week. The key is to start small. All of the practices we mentioned is something that you can try out. Focus on one area, and little by little, you can build upon it. So for example, if you want to bring more movement into your day, maybe start by setting a goal to add 5-minute stretches into your routine 1 to 2 days per week. And you already did one this week already, so you would maybe just have to add one more. And each week you can slowly build upon that practice and add more time in. Remember to be patient with these changes. And as a well-being coach, I've seen it happen, and I know Hajra has as well. When you make smaller changes, it can lead to larger, more impactful changes over time. And again, stay connected, get support from others when you can. I have a friend that I exercise with every week. It makes it more fun. It makes me feel supported. And reminder again, Hajra mentioned Heart Month. All of these practices are beneficial for your heart as well. So we can lead with that intention this month. And we will wrap up on the last slide. One more slide. Thank you so much for having us here today. Hopefully there's at least one mindfulness practice that resonated with you and you could try out this week. We really appreciate your time, and let us know if you have any questions.
I think I'll start. Did Rhoda leave?
Are you having connection issues, Rhoda? If you want to start, Ashley, because you're next, aren't you?
Yeah. Okay.
Yeah.
I'm gonna share my screen. Okay.
Thank you.
Thank you.
Thank you. Ashley, and Andrea, thank you.
Oh, sorry, Rhoda. Do you want me to continue? All right, maybe I should.
Yes, please go ahead and share your screen. And again, everyone, thank you to Allie.
All right. So yeah, thank you to Allie and Hajra. That was exactly what is going to lead into my project. I'm going to speak about my capstone graduate school program project. I did the effects of social emotional well-being through the use of mindfulness techniques, mindful strategies in PACU. So this is a subject that's sensitive to my heart. Being a nurse, I've been a nurse for 12 years. I have definitely felt my share of stress and burnout at work. And when approached in school to start a quality improvement project, I didn't know where to start. And I just kind of followed my feelings and wanted to help my fellow coworkers feel less stressed and burnt out. So I started my year-long project by conducting a literature review. I was researching healthcare workers and burnout levels. So why do healthcare providers have stress and burnout? Healthcare is a dynamic field that is constantly adapting. It's filled with advances in technology. We also then have strict regulations, evolving policies, and this puts a high work demand on the staff. This high demand leads to burnout. And just like Bernadette said earlier, since the COVID-19 pandemic, healthcare workers are feeling burnout at higher levels than before. Burnout is a syndrome characterized by high emotional exhaustion, high depersonalization, and a low sense of personal accomplishment at work. Sadly, these were all the feelings I was feeling myself, and I recognize them in my colleagues. But what can we do to help our staff? Throughout my research, I continue to find that incorporating mindfulness stress reduction interventions can decrease healthcare provider burnout, just like what we've learned today. Teaching our staff stress relief techniques can create a positive work environment. This is what our goal should be, to have a better work environment. By fostering an environment of well-being among our staff, we will positively affect the outcomes, patient safety, patient satisfaction, employee engagement, and overall unit morale. Stress relief interventions can decrease healthcare provider burnout by encouraging awareness, emotional regulation, and positive thinking. So I collaborated with Liz G, one of the well-being coaches at Columbia, as well as Ellie June, my PCD in PACU. I wanted to take my research and help my fellow coworkers. So we created a Wellness Monday. For 1 hour once a month, Liz, the New York Presbyterian Wellbeing coach, would come to PACU to share stress reduction strategies for staff. The plan was for Liz to be stationed in the break room, allowing staff 5 to 10 minutes to step away from the bedside to participate. The PACU break room would be transformed each month into a tranquil, calm space. We would dim the lights and use an oil diffuser as aromatherapy. Liz would lead staff in guided meditation and breathing exercises to reduce stress, agitation, anxiety, and pain. Liz provided individual aromatherapy for staff to pin to their scrubs, which then allowed them to have the added benefits throughout the day of work. We also gave out chocolates and teas, giving the staff a sweet treat as well as a calming benefit. And lastly, each participant left the sessions with a flyer detailing stretching and breathing exercises for them to use at home. Before we started our Wellness Mondays, I surveyed the staff. Here you can see on the left side the questions I asked the staff. I learned that 88% of staff feel burnt out, 62% of staff had negative feelings related to work, and 97% of staff felt emotionally drained. But despite these negative feelings, 73% of staff said they had someone to speak to about their mental health and their stress. But these results were kind of drastic, and it just goes to show how much we need to incorporate mindful activities at work to help reduce these numbers. So after we initiated Wellness Monday this summer, and after a few months of participation, I resurveyed the staff afterwards. After participating, the staff felt 100% said they felt less stressed, and 100% of the staff felt that they can use these mindfulness stress reduction strategies while they're working. 75% of participants have fewer negative feelings associated with work, and 87% said they have started to incorporate the techniques into their daily lives. So not only are they utilizing the strategies at work, but now they're taking it at home with them as well. Seeing the results from the survey and hearing the positive feedback from staff aligned with what I had learned in my research. Staff are using the strategies taught in the sessions and are able to feel the benefits. This was the ultimate goal of the project. There was still a lot of room for improvement, but I hope with continued efforts, we can continue to be successful to reducing healthcare provider burnout and initiating more unit-based initiatives like this. That's all I have. So thank you, guys. I hope we can take some of this information that we learned today and bring it to all our individual units. It was a really good project, and I hope that we can continue to grow from it as well. So thank you very much.
Thank
was
you
brilliant.
so much, Ashley.
Are you there, Rhoda?
And I can just see, yeah, sorry. I was just saying excellent work, Ashley, and I can just see everyone just beaming with pride, seeing you do that work, and so meaningful and impactful. I will leave a few moments. I would like Dr. Bernadette Khan to say a few words. I think this has just been really great sharing best practices today. Reminds us of all these things that we can do from moment to moment to focus on our well-being.
Thank you, Rhoda. Ashley, I agree with Rhoda. I was looking at you with a smile on my face because I did feel great pride for that work. And I think it will be fantastic for us to think about how we even expand to Tuesdays and Wednesdays, right? It's also, I think, such a great opportunity for us to share with everyone that's joining this webinar about the things we are engaged in as an organization to improve our wellness and just overall resiliency. And I think this is a journey, and we will continue to be on this journey because ultimately I think it's important that we all kind of pause and take care of ourselves as nurses. We're not necessarily really good at that, and I think it's important that we take better care of ourselves. And we have so many partners in our organization and in our lives that are willing to help us. So Rhoda, I really thank you for the opportunity for NewYork Presbyterian to be able to share some of the best practices we're engaged in on this journey to wellness. Thank you.
Thanks so much, Bernadette. And I know that, like me, and everyone, we have learned so much today, and to be inspired to make our well-being, our wellness a priority. What my key takeaway today, especially listening from all of our panelists, is that we don't need to wait until the end of the day, a long day or a long shift to do all these things. Mindful eating, mindful movements, and leading that within our circles and within our teams. And even, of course, taking that, outside of the hospital, in our own community. It will just make us a better team and a better nurse to our patients. I just wanted to share a thought. When I was listening to Allie share about mindful eating, I read a lot about mindfulness and try to practice it. And there's this one experience that I had, it says mindful cooking, that now when I slice a tomato, I pay attention to the texture of the tomato, whether there's like green spots in the tomato, and I look at, the plate when or when I steer it, I try to like really try to take the time to smell the aroma. And I don't have that luxury the whole time, but I try, when I can. And now Allie and Hajra gave us a very good reminder. And of course, the work that was shared by Stacey and Ashley. And I think I will just take a moment to say this will not happen without transformational leaders like our chief nurses here, Dr. Bernadette Khan, our patient care directors and directors of nursing, and our shared governance leaders who help us, be focused on our vision together. So we probably have like 4 minutes for questions, but before that, I would like to just share with you that being a global solutions initiative, there's a challenge that's put out there globally. You can submit your proposals. Most like the information and details is being sent out by our Nursing Now Challenge team on how to participate and submit your proposal to be supported by Nursing Now and New York Presbyterian, primarily in rolling out when your project that will be picked. And for New York Presbyterian, one of the contributions will be to support you in mentorship and in a professional development activity as a prize. So with that, I will pause. Maybe Andrea and the team, you can help me monitor a chat for questions to our panel. But excellent job, everyone, to our panelists. We're getting a lot of kudos on the chat box. Yeah, so overwhelming to see our participants from all over the globe, from South Africa to the UK, Canada. I put that all in the chat box earlier. Chicago, and of course, our very own New York Presbyterian team. Thank you. Any questions? If none, maybe any last words from our panelists? Ashley, thank you so much for that presentation. Any other, or Stacey?
I would just say that if it wasn't for the well-being coaches at New York Presbyterian, then we wouldn't have the success that we had for my project, but like in general, based off of what everyone presented today, having them employed at the hospital really gives the nurses support in a much different way than we've ever had before. And my project is still ongoing and we're learning from it, but having that support and the ability to do it is very meaningful.
Thank you. Thank you. And I second that, Ashley. One of the things that I just wanted to share to our audience is that we are so fortunate at New York Presbyterian that we have our well-being coaches working with us either one-to-one or with our teams right in the unit or remotely, like what we're doing today, to be able to get the support that we get for well-being. And one quick note that I will add is that well-being is so important that for the magnet framework, in nursing excellence, we have the magnet recognition program through the American Nurses Credentialing Center as the gold standard of nursing excellence. It is so important that it is one of the standards that we need to showcase and meet for our designation. So clinical nurses and our nurse leaders are asked to champion nurse well-being to promote retention and excellent patient outcomes. So I will just make that plug for Magnet. All right. If there are no more questions, Sarah has a question. How can a nurse be aware of the offer of moments with competitive distraction that are consuming in healthcare environment. So I think Sarah's asking here, like, we're so busy, right? There's so much distraction in our day-to-day work, especially in the clinical area. So what are other tips that we can do? Maybe Allie?
I can speak to it. I think one of the important ways is that we're looking for ways to hardwire it in. So not necessarily having you wait to seek out the resources, but starting our day by just taking a moment to take a deep breath. So we're already finding ways to incorporate things into everyone's already busy schedule so that if they don't have the time to do it, they're still getting the benefits of having those elements. And it's also why we're looking at resources that they can take home and also utilize on their own time as well.
Yes, yep, thank you. That's an excellent recommendation, Stacey. There's one question, is there any weekly mindful activity we can involve in via Zoom? Well, that's an idea for our Nursing Now Challenge team. We'll definitely follow up on that. And that's Saima Alwani. We'll make sure we follow up on that. Yeah, that's a great idea. Okay. I think with that, we are 12:01 here in New York City, 4:01 in the UK, and I'm sure it's another time to our global colleagues who join us. With that, we thank you so much for joining us on our second session. The third session will be in March, most likely March 1st, but we will be sending you more information about that. Thank you to our panelists. And thank you to our Nursing Now team. Have a great rest of your day or evening.
Bye, thank you.
Bye. Thank you very much.